Hello, this is Dr. Gay from First Look MRI, and this is a 46-year-old male who fell recently. They have some significant findings here, so we're going to run through just a few of these. Number one is on the medial side. Another one is right in here, the sinus tarsi, and there's another one over here on the lateral side. So starting on the medial side, we see the posterior tibial tendon has a partial tear. So to get our bearing straight here, this is the posterior tibial tendon on the medial side. This is the flexor digitorum. This is the flexor hallucis. This is the muscle of the flexor hallucis, and there's a little bit of fluid around it here. As we go down, we see the posterior tibial tendon here is going to come and it's going to attach to the navicular bone. Here we see these three, Tom, Dick, and Harry. Down, down, down. And you're going to see these two cross over each other at the knot of Henry, that we call that. And you can see them cross over. And these are the flexor hallucis. It's going to go here to the great toe. Flexor digitorum, go to the other toes. And there's that fluid distending the tendon sheath at the knot of Henry. And now we're going to try to find the posterior tibial tendon. So this is the posterior tibial tendon, looking pretty good. A little bit elongated, but not terrible. This is looking okay. But when we get to this cut, things are just a little bit too big. Normally it can expand here. It has some other attachment that come off. And to have it be a little bit big here is not too big of a deal. But we see a little bit of bright signal or increased signal here at the interface. Here's the navicular bone. And there's a cortical, the cortex there, and there's a little bit of brightness. And here there's some more brightness. This is abnormal. We never see a nice dark tendon coming down here. And even if it's a little gray, this is way too thick, and it's not gray all the way to the cortical margin. It's just bright along the cortical margin. So this is partially torn and stripped from the navicular attachment. The posterior tibial tendon is. So that's one finding. Now we're going to go to, over here we see the sinus tarsi is right in here. Lots of brightness through here. So this is edema within the sinus tarsi. So they have an injury of the sinus tarsi ligaments, or they have abnormal stress in them because of the posterior tibial tendon dysfunction. Now there's too much stress on these and you get reactive edema. And let's look at both these in the sagittal images. Here we go. This is a sagittal T1 image. The posterior tibial tendon is going to come down here. It looks nice and straight. And here's the end, and there's a little gap right here. This is the navicular bone. So the orientation is a little bit abnormal. It goes too far posterior. It should come right over here to the edge. So it's partially torn and stripped here. And the sinus tarsi is right in here. Normally there's fat in the sinus tarsi, so it should be bright, but instead we see this is dark, filled with inflammation. And there's one other finding here, which we'll show you in a second. Here's that sinus tarsi edema, inflammation. And now we're going to come over here to this posterior tibial tendon again, comes down. Hard to see on this, but we never see it attach up here very well, or attached to the navicular bone. So posterior tibial tendon torn and stripped off. Now we're going to go back to our axial images and look out here laterally. So on the lateral side, this is the fibula. We see something coming off here. This is the anterior talofibular ligament. When there's an ankle sprain, this is almost always the one torn, but in this case we see perfectly intact, a nice big thick one. You see it really nicely, so the anterior talofibular ligament is intact. This is the posterior talofibular ligament. It's broad, comes here horizontally, and it's intact. This one's almost never torn. If we go down below, we see another one coming from here. This is the calcaneus. This is the calcaneofibular ligament, going to come up underneath the peroneus tendons here, peroneal tendons, and it's going to attach over here to the bottom of the fibula. It's hard to see, but the calcaneofibular ligament is intact. So these things that are typically torn are not torn. And now we're going to go up to the tibiofibular ligament. So again, this is the anterior talofibular, posterior talofibular, calcaneofibular ligament are good. Now we're going to go up, up. Now we're going to look for the anterior tibiofibular ligament. So here's the tibia, there's the fibula, and let's find that ligament here. And normally it's about right here someplace, but instead we just don't see it. There's some fogginess there, and so this is a ruptured or completely torn anterior tibiofibular ligament, which is pretty rare. When you have this injury, you always think about something up higher. So we're going to look up higher as well. This is the posterior tibiofibular ligament. And we can see it comes across here and attaches to a fracture. There's a horizontal fracture line here. And so this fracture fragment is here, and the ligament is a little bit thick, but is not ruptured. Now we're going to go up higher to the syndesmotic ligament between here. This is the interosseous membrane or syndesmotic ligament, so we should see some little band coming across here, but instead we don't see that. It's not terribly widened, but we just don't see the syndesmotic ligament, and that makes sense. When you have a ruptured anterior tibiofibular ligament. You get a high ankle sprain, which also includes this. And we should also do x-rays higher, see if they have a fracture of the proximal fibula, and this patient did not have that. This is a view we're trying to look for that interosseous membrane, and we just don't see a nice and dark line coming across there. Usually there's some oblique line. You can see something on one view, but here there's just a bright signal. So there it is. Evidence of a high ankle sprain associated with a fracture of the posterior malleolus and edema within the sinus tarsi, and a tear, a partial tear of the posterior tibial tendon from the navicular attachment.